Also tonight, the man tasked with reviewing the care of potentially hundreds of patients harmed by a Dundee neurosurgeon has said the scale is worrying. The man tasked with reviewing the care of potentially hundreds of patients harmed by a neurosurgeon in Dundee has said the scale is worrying. Sam Eljamel carried out more than 4,000 operations during the 18 years he was employed by NHS Tayside. Professor Stephen Wigmore, who's leading the independent clinical reviews, says there's an issue with incomplete records. Lynn Rankin has more.
Her face was completely collapsed on her left-hand side.
In 2007, Karen Walker had surgery to remove a brain tumour. During the operation, her facial nerve was severed, leaving her permanently disfigured.
We were never ever told it was transected. We were told that it was tatty due to the operation, and that it would hopefully grow back, was the words. Pain, can't see properly, became housebound and wouldn't go out because of it.
This is the man responsible. Sam Eljamel was head of neurosurgery before he was suspended in 2013. He carried out more than 4,000 operations during his 18 years working for NHS Tayside. Professor Stephen Wigmore now has the huge challenge of reviewing patients' care.
The fact that so many people are concerned that they've been harmed is very worrying. I think that the independent clinical review has an opportunity to look not only at the individual patients but at the patterns of harm.
Patients have now met Professor Wigmore to discuss the scope of the reviews.
Very moving to hear some of their personal experiences. We haven't ruled out the possibility of a clinical examination in some cases, but I think really they would have to be a compelling reason to want to do that.
But many patients say they've lost trust in the process after NHS Tayside was forced to apologise for sending the personal details of 132 patients to the professor.
I apologise for my part in an unwitting mistake. Nothing in that data is anything that we won't be asking anyway. And actually, I'm particularly interested in patients who have previously made a complaint, because we're interested in how NHS Tayside dealt with that complaint and what the outcome of it was.
Professor Wigmore hopes to start reviewing patients' care as soon as possible, which will form part of the clinical evidence for the public inquiry. Lynn Rankin, STV News.